Hi there, it's Frankie here from Amat Chiropractic, and today I wanted to talk to you about tennis elbow. Tennis elbow tends to be pain that is kind of focused to this point here in the elbow, and it can also cause some symptoms down the arms, things like pain, some achiness, even some loss in grip strength, or you might find it difficult to lift the kettle, those sorts of symptoms. Classically, it used to occur in tennis players quite a lot because of the backhand type movement, but nowadays it tends to happen with those desk jockeys, the ones that are on using mouse all day and using these fingers. What that tends to do is cause a huge irritational point through here. Reason being is the muscles are overworked essentially, because the muscles that allow your fingers to move and your wrist to bend focus onto this point here. This is one of their attachment points, and this is where you'll get some area of inflammation and pain, which can then cause you tennis elbow type symptoms. So it's a really quite common problem that people tend to come in with. It's usually one that they forget to tell their chiropractor. We love to treat things that aren't just your spine, so please do mention them to us when you do come in. But there's lots of things that you can do for yourself at home as well. Because the muscles through here tend to get really ropey and quite tight, a little bit of massage work can be really beneficial in just relaxing those off. So apply a little bit of cream to the forearm. Now, whenever you do massage work, make sure you work back towards the heart. You don't want to encourage blood flow back down into the peripheries. So make sure you do your strokes all the way the back like that. So using your fingertips, you can just pass through the muscles through like that, or you can even get your thumb in. That's what I'd be doing with you. I'd be getting my thumb stuck in to help release those tight muscles. And you can spend a couple of minutes just sweeping up through the forearm, trying to find those tight bands. They'll almost feel like elastic bands. They'll kind of ping around as you go over them. You can also use a cross friction sort of technique as well, where you go across the muscle bands. And as you can see, I'm just turning my wrist in and out as I do that, and I can work up and down my arm to help release those tight muscles in that way as well. Spending a couple of minutes a day doing that can be really helpful in reducing those tensions, and hopefully will help with the symptoms that you've been getting. You can also stretch the muscles out as well. The best way to do that is to basically you need to lengthen the muscle as much as you can and then hold. So what you want to do is bring your hand down. You need to flex the wrist. So when I say flexion, I mean bring the palm of the hand towards the body with your other. Keep a straight elbow here, and then use your other hand just to hold that stretch through there. Hold it for between 10 and 20 seconds, whatever feels comfortable. Release it off and repeat a couple of times. And doing this regularly will also help to reduce some of the tension through those wrist extensor muscles. Through this area as well, you can also sometimes get pins and needles into the hand, and it can be quite irritating whilst you're trying to work. Reason being is because you've got lots of nerves that pass down through this region, and if the muscles are really tight that are around the nerve encasing it, then the nerves can get a bit irritated and start to set off symptoms like pins and needles. So what we can do is a technique called nerve flossing. What it essentially does is allows the nerve to kind of move and floss, as it were, within the muscular tissue. It can sometimes set the pins and needles off, so kind of be careful with it. And if it makes your symptoms worse, then please do stop. But it's a really useful technique in helping to reduce that. You've got 3 nerves in your forearm there because it's quite a complex region. You've got your radial nerve, which runs along your radial bone, your ulnar nerve, which runs along your ulnar bone, and your median nerve that lies through the middle. And quite commonly, it's usually more than one nerve that kind of gets involved, so it can be good to do a nice stretch through there. The nerve flossing technique I'm going to demonstrate doesn't target one particular nerve, it will kind of target all of them. The way that you do it, I'm going to do it from the side here. You're going to stretch the arm out, and as you do that, you're going to tilt the neck towards the arm. So as I come through here, you can see my hands coming down, I'm going to flex, I'm going to tilt my head towards, and then I'm going to ease it off. And I'm going to tilt towards and ease it off. And you can repeat this sort of 8 to 10 times, and that will help to floss the nerves. The reason why we're getting the neck involved is because that's where these nerves originate from. The nerves exit through the lower cervical vertebrae in your neck. They form the brachial plexus, and then they split down into the 3 individual nerves down your arm, and that's what supplies your hand. So when we bring the neck towards the arm, that helps to just slacken off the nerves at that end. If you do it up the other way, it might cause a little bit of irritation. So give those 3 things a go. massage, stretch, and a little bit of nerve flossing. You might need to also look at the way that your hand is positioned as well when you're holding the mouse. Make sure there's no bend in the wrist and make sure it's kind of nicely supported. Just putting a little support underneath the wrist can actually be really beneficial. Make sure you take regular breaks, and all those things combined should really help with the tennis elbow type symptoms that you're getting. If you've got any questions, please do fire them off to me. I'd be very gladly to help and answer them. If you think there's somebody you might know that might benefit from this information, please do share this video with them as well. And that's all for this week. Thanks very much. Bye bye.